Hi, I'm Christy Bemis, and I am your host for Authentic AF Conversations with People in the Ignite Your Life classroom with Christy Bemis. And I'm here as a psychotherapist, a sex educator, and a relationship expert. My true passion in life is to guide you to have deeper connections, stronger ways of communicating with each other, and more intimacy in your life. And each of my guest speakers are here because they feel as passionate about their topic to enhance your relationships as I do. So, welcome. Sit back, grab a journal, grab a pen, because this isn't your normal podcast. This is not just a sit and get. This is a classroom to enhance your experience. There'll be journaling prompts, guided experiences, questions to ponder, and more. So, welcome to Authentic AF Conversations.
Awesome.
Hello and welcome to Authentic AF Conversations. I'm Christy Bemis, and I'm so excited to be joined today by psychologist Dr. Tory Elliot out of the Milwaukee, Wisconsin area where she practices. And we're focusing our conversation today around mental health, specifically around personality disorders that are often flagged as like this chronic, shameful condition. And so today, we're going to be dismantling some of our thoughts around that. And I'm really excited because um, Dr. Elliot has expressed her thoughts around it. And that's why I really wanted to have her here with us. It's often this misunderstood diagnoses. And so today I'm hoping that the listeners find a place of compassion and a place where they can really hear the humanity behind the conversation and not just the pathology around it. And I just want to add a disclaimer whenever I have an expert joining me, I always want to add that this is educational and information. It is not to replace any proper diagnoses, assessment by a professional that you go to in person and get properly diagnosed. So hopefully you find this to be compassionately informational for you and for those listening. So welcome. I did
Thanks.
not do you justice in your bio, so I'd love to hear a little bit more about your background and what you practice and what lights you up in that practice.
Yeah, to be fully authentic as you welcome, I hate writing bios. I have a really hard time like writing about myself and trying to figure out like what's important and what's not important. But anyways, I could say that, I typically say that I'm a trauma psychologist.
Hmm.
Um, I think that if I can boil my job down to one thing, I get to be human with other human beings. Um, and I think that, shows up in the way that I practice. I'm very relational. I do a lot of developmental trauma. I work with a lot of individuals who, have some sort of marginalized identity, as a lot of us do. And so, yeah, I say that I specialize in working with personality disorders, but that's a hard thing to say because we'll get into
I know.
a conversation as well about how I feel about a personality being labeled as disordered in general.
Yeah, and
Yeah.
that's why I was really excited to talk to you because we met through an online forum where therapists kind of hang out, and you had a really interesting perspective that I have believed all of the 20 plus years that I've worked as a psychotherapist, and a lot of times earlier on, mostly in my practice, I worked a lot with mostly women and mostly women that had been diagnosed as borderline personality disorder and kind of characterized as like so difficult to work with. And so I'm really excited to kind of dismantle that a little bit with you. When therapists hear the word, or when anybody out there hears the word personality disorder, I think one of the things I'd like to invite in a conversation with you is what that means, or what that even means to like our nervous system when we hear that.
Yeah, I think that that could be, you and I. had talked about these like two reactions, right? Like a reaction from the clinician and also the reaction from the person who's receiving care, right? Or who has this diagnosis. And I also want, like to address on the table that a lot of people are self-diagnosing through TikTok,
Yeah.
Instagram, and social media. And I think that that can be absolutely like wonderful to increase just awareness. But I think a lot of the times it's spun as this like manipulative, fixed, difficult person to be in a relationship with. And I
Yeah.
think like when we talk about our nervous system, I think that these are templates that we have developed to be in a relationship with people. So
Mhm.
the practitioner, like the clinician, and also the person who has the diagnosis are equally triggered on
Yeah.
purpose, right? Because like the relationships are the threat. So like the way that our nervous system is triggered is different depending on which personality disorder, but that's kind of just like automatically what's happening in the room with people.
Yeah. And I remember early on in my career being really afraid of the diagnoses. But I also remember the very first time I worked with a woman, and I went through months of working with her before I actually even cracked open the pathology around it and said, let's look at this together. And I just remember how valuable it was to be forthright, upfront, looking at it compassionately together, and then asking my client, what do you think? What do you think is going on? And just like the significant compassion around the trauma she had experienced in her life up to that point. And like, you don't have to keep living like this.
Yeah, and you know what's amazing to me is that, and you're in this field, so you also tell me like, what you have read or have noticed, but there is like always a conversation about like the high correlation, especially with BPD. I don't hear this around like other personality disorders as much, but a high correlation of trauma, but
Hmm.
they're almost never directly connected to each other. And it just like it fascinates me so much because even with people who, like women are more highly diagnosed with borderline personality disorder, and men are more highly diagnosed with narcissistic personality disorder.
Hmm.
And when we talk about like societally, how we're allowed to be emotional in our genders, assuming there's a binary, right?
Hmm.
And men are told that that they can't be small, that they have to be tough, that they have to be, right? So their attachment in the way that it shows up is pushing people out and kind of like and fighting, right? And so I kind of like I just went off on this like rant and
I
forgot like
yeah, but I love that because what it's reminding me of where women you said are more diagnosed borderline
mhm,
personality and men
mhm.
narcissistic. One of the things that when I'm working with somebody who I'm like, there's a fair amount of like grandiosity going on here. There is something in their childhood. Like I remember working with a man who walked in on his mother having her like third or fourth affair and the secret keeping and false entitlement that he had to hold that like I'm holding this and how that carried then into his relationships later on. I had so much compassion for that. Like that should never have been had to have been held by your 8-year-old you or your 10-year-old you or your 15-year-old
Yeah,
you. Like that's a lot to be falsely empowered around holding. And
yeah,
so then that expectation goes into the adult relationship world as this maladaptive entitlement that was planted, was parented that way.
yeah, and this like like with narcissism, there's this distance that you feel with people. And I
Hmm.
oftentimes like equate this like in attachment terms. So, there are four different attachments, and you have secure, which I always kind of joke around like as being more of an anxious person myself, but being a trauma psychologist, it's supposed to be one of the most common, but like, where are those people? I don't
I don't know. I mean, we're a little biased in that we don't see many of them, but
know.
even myself, I am avoidant attachment. Like you throw
Okay.
the list down, I'm like, that's me. I can do things on my own. I don't need to be dependent on anybody and at the sometimes at the price of intimacy
Yeah.
throughout my life. And so I've had to do a lot of work around the attachment stuff.
And I appreciate you being like, open and vulnerable about yours because I'm on the other end of the spectrum. I'm anxiously attached. And so,
Hmm.
like, my kind of like responsibility in my family has always been like, my safety has always been dependent on how I am serving other people, right? Like, how in tune I am with other people, how kind of like open and close I am with other people. And so, I diagnosed myself with BPD, but my therapist doesn't agree with me. But just thinking about like, right, like that is my template for
Yeah.
relationships to seek closeness and your like template, right, that you have been given. And I want, like, I always want to emphasize that this is not something that we are actively choosing, that this is something that
Right.
has been given to us, right?
Hmm.
And so your template has been just distance, right? Like
Yeah.
I'm independent, I can do things on my own, it's better off, yeah, without somebody else next to me.
Yeah, and there's lots of resources that listeners can go to look at attachment styles. I mean, I think that in the book Polysecure,
Mm.
whether
Mhm.
you're seeking poly or not, she has one of the best overviews of each and every single attachment style and where it comes from as you're growing up. And Stan Totkin's work is really good around attachment theories and attachment styles and how they play out now. So there's lots of material, but what I like about what you're doing with it and the paradigm shift that probably a lot of our colleagues would get up in arms about, right? Like,
Yeah,
how dare you
yeah, yeah,
question the DSM is about that word template, though.
yeah,
Like the imprint that we are, one, our temperament, we're born with certain temperament styles that clash or go well with our parents.
yeah.
And then two, it's all of these experiences. And so what does that do for the listener who's like kind of questioning, do I have a personality disorder or I've been diagnosed previously by a therapist or a specialist? What does that template kind of conversation do you hope give to your clients or potential people listening?
I think that my hope is to breathe compassion into these people who have been given these templates from both like the clinician standpoint and also the person who has this diagnosis or who has this attachment style or who has this template, however we want to
Hmm.
like frame that, right? That again, this is not something that you chose to necessarily have, but that you can kind of like create an understanding around it. I kind of call, not kind of, I a lot of times call, the way that we have learned how to relate to people like our superpowers in childhood.
Oh, I love that.
Yeah, yeah, like they really like kept us safe, right? Like
Yeah.
it was our way of our best attempt to stay connected with people
Hmm.
and to stay connected with ourselves. And when you have a personality disorder, you can't technically be diagnosed until you're 18. I
Hmm.
know that some people diagnose earlier or like suspect earlier, but I think the reason we feel that friction when we're older is because like those superpowers like no longer work for everybody as our world gets bigger, right? Like as we step outside of our childhood home or homes or places, like we're meeting new people, like it's either helping our relationships or harming our relationships. And most
Yeah.
often it's like it's harming. It's not exactly creating healthy relationships like we want. So I think that's when we
Yeah.
start feeling our symptoms more.
Yeah, because relationships are shutting down or falling apart, or we're falling apart within a relationship. And so, yeah, in Terry Real's work, which I study, relational life therapy work, he talks about adaptive then, maladaptive now.
Yeah.
Like it was the most important part of your survival skill growing up, and it's the least helpful in your relationship now.
Yeah. And like, I don't like when I talk about relationships, like, I think like we're talking about every facet of our life, really, right? Like,
Mm.
where in our life do we not have to deal with other people, right? And so it shows up at work. I think it shows up in the type of work that we do. I think it shows up like, in our hobbies, it shows up in our friendships, it shows up in our family, like it shows up in our relationships with ourselves.
Mhm.
And so like we're talking about relationships, but I just like it encompasses so much more of what we think are relationships.
Yeah, even how we parent. Yeah, all of the things. Even how I am in relationship and traffic or like dealing with the daily frustrations of life. Like our nervous system is really, wired and dictating. Um,
Yeah.
so there's often this, I think, an error of feeling of if you're diagnosed or you suspect you have a personality disorder of any kind, that it's like this death sentence, you'll never get better. What are the things that you really lean in? I did see on your Psychology Today profile, you really love dialectic behavior therapy. I love that too. I think those are life skills that should just be taught in every single like high school.
Yes. Absolutely. I will say I have this like complicated relationship with dialectical behavioral therapy, which in
Okay.
short you'll hear as DBT. So, for those who are listening who are not in the field, DBT was created by somebody who has borderline personality themselves. And I'm probably going to get a lot of flack for saying this.
It's okay.
So,
Be
I'm
authentic.
I'm willing to take whatever comes out of this. But there is this like rigidity to it. And
Mm.
if you do, so they have like a full model program where you have like check-ins with your therapist or like, calls with your therapist. You have group, you have individual, but it's also this like really boundaried still method of relating.
Mhm.
And so I think that in part it reinforces that this person has to have these boundaries forever. Do you know what I mean? Like when I say
Yeah, give me an example of like a boundary that you just really don't think is helpful with the client. Like I'm thinking of some regarding, I do a fair amount of personal disclosure.
yeah, yeah,
I share, like, I'm not sitting here in this chair as like some bookend expert of like your life. And so there's a fair amount of disclosure where DBT doesn't really allow for that.
yeah. I think about like the way that the word manipulation is used,
Hmm.
like in DBT, and I don't think that it is necessarily like there's a lot of like unspoken things that go into treatment, but like manipulation and staff splitting, which is I think so. What is that word? Like making somebody so small, right?
Hmm.
Like not minimizing, but infantilizing. Is that how you say
Hmm.
it? But like, that we have to have, I view boundaries as like thick or thin. So the fact that we just innately have to have really thick boundaries with the people that we work for, I think is reinforcing this template that we have as clinicians and also like the given template that they have. So, with suicidality, which is common with people who have borderline personality disorder, they're not being suicidal to be manipulative or to get attention innately. Um,
Mhm.
However, maybe when they were growing up, they learned that the only way that they could get attention and affection is by not being well, is by like being sick,
Mhm.
is by, like by being suicidal. And I don't think that this is something that we are consciously doing. I think it is like, again, subconscious or unconscious through interaction after interaction after interaction after interaction, right? It's this like template.
Mhm.
But I don't think that there's compassion in those parts of it.
Yeah. Yeah, and I think that when you're in therapy and you're working on things, there is a level of making the subconscious conscious. Once you see it, you can't really unsee it. Oh, that is manipulative, isn't it? And then once you see it and can't unsee it, then that second level of consciousness is this new way of thinking, relating, behaving. So I think that there is hope for people. People change. I mean, we would not be in I don't think I would not be in the position I'm in or doing the work I'm doing if I didn't think people could change, get healthier, think clearer, see things differently.
Yeah, I agree with you. And and again, not to, like bash DBT because I do think that
Hmm.
there's like incredibly important messages in there that we, like you said, I think that these are the things that we should learn as
Hmm.
as just like human beings, that we don't like get often, but to kind of push this off as a problem of like, okay, you just have to develop skills to manage it and you're never going to get better is like, it's so sad and in itself like reinforcing that this is a chronic, not fixable or changeable diagnosis. And I don't agree with that at all. Just like you said, as soon as we become aware of it, then we can decide, okay, like, how do I want to relate healthier? Do I want to carry this forward? Oh, okay, I see how this is affecting my relationships. Like, I don't have to do this anymore. And we can
Hmm.
sort through and decide those. But I think that that only works like as we're trying to build, like, I think that relationship wounds can only be healed in healthy relationships.
Hmm. Yeah, and working towards like those healthy relationships. And a lot of people think things like, until I'm fully healed, I'm not ready for a relationship. And I'm like, oh man, the relationship is the very thing that you get to like have a practice playground, hopefully with somebody that you really love, and that they're practice playgrounding with you, and you both are learning better relationship skills so that you can move forward in healthier ways together. Um,
Yeah,
Doing it on
yeah.
your own solo, you're not going to be triggered into, your things, your stuff. So I
I
don't know how
really
much
like
work can
that
be done.
you like mentioned that because I hear that so frequently that I need to be, like fully healed. And I don't know if you think about this like, as a therapist yourself or as a provider, but like I'm not fully healed,
No, I'm in
right?
my 50s. I'm not, and I don't think I will be till my last breath. I mean, ask
Yeah,
my kids.
right. And I'm just like, who gets to decide,
Yeah,
like there's no check mark that we get or like an A+ for being like,
right.
yay, you got it. Like we're constantly learning things about ourselves. We're constantly
Hmm.
learning things about other people. There's going to be like things in our life that like make us relate differently. Think about how much
Hmm.
of our world is virtual right now. That wasn't, pre-COVID. That changes the way that we relate to people. Like social media changed the way that we relate to people. So we're just like constantly going to be like learning and unlearning. And I think that's exciting and some ways exhausting. And
Yeah, to be
like,
human is hard sometimes. And I think when you're in a relationship too, especially as you move through long-term relationships, I think Esther Perel says it best is that her husband and her have been married like 30 some years and he's been married to four or five different versions of her, and so we grow and we evolve
yeah.
hopefully together in relationship when it works. So what would your kind of like parting thoughts be of somebody that's tuned in and they're curious about this in terms of messaging? I mean, you have such a compassionate anti-stigma messaging, which is like right up my alley in terms of how I treat humans in my world, whether they're clients or just human beings in my world. What would
Yeah.
you want people to take away and the message you'd want to send them?
I I really hope that it's compassion
Yeah.
and self-compassion and curiosity for
Mm,
yourself and for other people. And I say that and I if people feel like, they're curious about exploring how they relate to people, like maybe they feel like they're having a hard time being in relationships, I would say go to therapy, but I say that knowing that you have to find the right one.
yeah.
Um, that you really have to advocate for yourself. And if you're not feeling if you're not feeling good or if you're feeling dismissed or you're not feeling connected, which is hard, um, advocate for yourself because there's,
Hmm.
like we've been talking back and forth, there's people, a lot of people in our field who kind of like pass the puck on people who are diagnosed with personality disorders as being difficult, and it doesn't
Hmm.
have to be that way. And so if I can like leave anything, I think it's just like have compassion and curiosity and just know that you don't have to be here forever, like that forever. I think that's what I would leave with.
Yeah, that transformation is possible and that and what I'm hearing you say is therapy is helpful. I often tell people try a therapist out 2 to 3 times and just really feel into is there trust here? Can there be trust built here? Because I can be a therapist that comes in with this whole bag of tools, right? But if there's not like a relational trust, none of those bag of tricks are going to be incredibly helpful to somebody. So,
Yeah, and like I think like especially for people who, maybe have never tried therapy before, it's hard to know what is right, especially if you, again, if you have this template that you either have to be super distanced with somebody, right?
mhm,
Or you require a little bit more closeness with somebody to trust them. It's hard to know what's a good fit. And so I think like being as open as possible about how you feel also like
mhm.
towards your therapist and with your therapist is incredibly important. And I know that that's a hard thing to do. Like me, I'm in therapy right now and I literally just had a conversation with my therapist last week of like, I don't think I'm doing therapy right. Like in my own
Mhm.
work, and
Yeah.
she's just like, Tori, stop. So like even somebody who is supposed to be like, like hold expertise in our
Yeah.
fields, I oftentimes doubt that I'm doing things correctly. So
Mhm.
allow yourself to like bring that in, like ask those questions. Like if you
Mhm.
don't like your therapist, talk about that because maybe it's the template you were given, or maybe it's genuinely not a good fit.
Yeah. Yeah. Do you feel seen? Do you feel heard? Yeah. Those are super important things.
Yeah. Yeah.
Well, how can people get a hold of you? I love the work you're doing and I love I like the trajectory you're taking your career as a therapist, and how can people get a hold of you?
Yeah, so I am on Instagram and Facebook. My Instagram is, I think, Dr. Tory Elliot,
I think so, yeah. Hmm.
and I am in the process right now of creating a website. I'm sorry if you can hear my vacuum upstairs.
Cannot, no,
Oh,
your
awesome.
sound is
Okay.
great.
It
Yeah.
sounds like it's going crazy, but so you can contact me, follow me on Instagram. Uh,
Hmm.
but I'm in the process right now of getting my website up and running. I'm a provider at LifeStance and I will be like with LifeStance for foreseeable future, but I just got an LLC for Center for Self as like
Right.
a reclamation of, we have this like negative connotation that we can't be self-centered. So
Yeah,
um, I am in the process of getting my website up and running and, hosting things through that and doing different partnerships. So
great. I
that's
can't wait. And I can't wait to like do more collaboration things with you. So, yeah.
yes, I always feel like so
Mhm.
energized in my conversations with you. I know we're like just beginning to know each other,
Yeah.
but I appreciate the space that you give people and the information that you give. And yeah, I just appreciate you.
Yeah. Thank you. I feel the same. Well, thanks for joining us. I hope that you got some valuable information. I hope you feel compassionately heard and seen, or if not you, somebody in your life who you love who might be struggling with a mental health issue. Make sure that you hang in there and advocate for yourself and advocate for your loved ones to get the support and the help that they need. These are authentic AF conversations. You can find me at www.christybemis.com. And on there, you'll see a Sparks assessment for couples, as well as all of the offerings that I do, including retreats. So continue to join me in these conversations. And in the show notes down below, you'll be able to find Dr. Tory Elliot as well. So thanks for joining me. And it's been a super pleasure to talk to you. And maybe this is the first of many conversations, Dr. Elliot, that we'll have together.
I hope so. Thanks for having
Yeah.
me.
All right. Stop recording.